Welcome back. The CDC today said that COVID deaths are on the rise again after weeks of declines, and the news comes as Los Angeles reinstates its mask mandate wearing indoors, even for people who are vaccinated. Joining us now is Dr. Esther Choo, Oregon Health and Science University Professor of Emergency Medicine. Doctor, thanks so much for being with us. This is very troubling news coming out of the CDC today about these rising death figures. What do we know, and is this happening mostly amongst the unvaccinated in country?
Yeah, this is really tough news to hear because I think in a lot of places, as restaurants and other businesses opened, we have started to feel like we're coming out of this. But Delta variant has really changed the equation. So in places like LA, where cases are surging and hospitalizations and deaths are surging, we do need to loop back to safety measures that were in place a few months ago, things like universal mask wearing indoors. And so kind of grim news, but we're seeing rises in cases and hospitalizations and deaths across the United States. And I think we have to remember that decisions about mask wearing and other types of social distancing and virus mitigation are really local decisions that local public health officials need to make as necessary in order to curb the spread of disease. The good news for the vaccinated and for the vaccine program in general is that these cases are largely in the unvaccinated. So in LA County, all of the hospitalized cases are among the unvaccinated. And we're seeing the same pattern among deaths. I mean, above 99% of hospitalizations and deaths are among the unvaccinated. So we are seeing that this disease is largely preventable now, and we really need to continue pushing for vaccination everywhere and in every population.
And in those instances, doctor, where we do see those breakthrough cases, meaning that people fully vaccinated are getting COVID-19, is the severity of the virus in those people much less severe?
Yeah, there's a lot of talk about, people are getting COVID anyway, even though they're vaccinated. And that is true, and that is expected because there's no vaccine that's 100% all the time. So we are seeing these breakthrough cases. Many of them are are totally without symptoms, and they are getting testing as part of, contact tracing or other screening so that they can go on to certain activities, or they have very mild symptoms. So even when there are breakthrough cases, for now, we're seeing that people still have protections that are keeping them from becoming seriously ill, getting hospitalized, and being higher risk for death. So this remains a very successful vaccine, and the message is still people need to get vaccinated. It does mean that we can't really rest on our laurels. So we can't say, well, I'm vaccinated, so there's no chance that I can acquire or spread COVID. And that is why, in many settings like hospitals, even though we have really high vaccination rates, we continue to wear masks. We have medically vulnerable patients. There's not a zero chance of transmission, even with full vaccination. And there's a lot of variability depending on the host. If I have, say, some sort of immunocompromise that keeps me from a full response to the vaccine, I may be more vulnerable. So there are a lot of exceptions. So there are certainly settings and times and places where we need to continue mask wearing even with vaccination. But it is a layer of protection that is extremely effective still to date.
Right. And yesterday we saw the nation's second largest nurses union asking that indoor mask mandates be put back in place. I want to ask you what President Joe Biden is thinking about this week. He said that the U.S. is going to review whether or not it can lift restrictions that ban most non-U.S. citizens from traveling to the U.S. from much of Europe. Given the state of affairs right now in this country with rising hospitalization and deaths due to the Delta variant of COVID-19, do you think now is the time to be opening up our borders more to the rest of the world?
Well, this is a little tough, and this is why President Biden is taking a little extra time to review this from a scientific and public health perspective with his COVID task force. I think the issue is our borders are porous, even with travel bans. We are taking advantage of eased restrictions to other countries like Europe, where Americans can go in as long as they're vaccinated. Sometimes we're talking about travel in between countries where vaccination rates are very high. There certainly can be parameters put on travel back and forth to the U.S. by non-citizens. And I think what we're seeing is that our existing travel ban has not kept variants away from our shores. So it's not like it's isolated us from COVID variants. We get them like everybody else, and they travel very very easily, because there will always be some back and forth for various reasons. So I think their review will basically say, is it an important part of our mitigation and containment strategy? If not, what are the parameters we can put, the restrictions we can put with travel, so that we can feel like we're keeping people safe as they travel in air in this enclosed space, and also that we're not increasing the vulnerability of our country to another surge. So I have no doubt that this will be very well and carefully thought through, that we will have rationale, and that we will also understand the rules for travel.
I also want to ask about something we saw yesterday in the MLB, the Yankees having to postpone their home game against the Boston Red Sox because 6 Yankees players tested positive for the virus. Unclear as to how many of them have been vaccinated or not. We know that the entire team has not yet been vaccinated. But I guess for me, it was eerily reminiscent of what we saw just a few months ago. It's sort of a little bit of deja vu all over again. Do you think that the warning signs are up, that this virus, that another wave is coming? And in some respects, are we as a country keeping our head in the sand, Doctor?
Yeah, when I first saw that news story, I thought, oh, this is an old news story. For some reason, it's being bumped again. It's exactly, I thought I made an error. And then, I have family members who are in mourning because that game was canceled. I mean, it really was something they were looking forward to. So sorry to all the Yankees and Sox fans out there. But, this for us should be a big illustrative case of how this can go down. The fortunate thing is that nobody is gravely ill. And we know for sure that 3 of the players in the Yankees are vaccinated and did test positive. And so we're seeing what we know to be true, which is we're going to see breakthrough cases. And I think the lesson is, when you're in mixed company, which these players are because they are not 100% vaccinated. And earlier this week in the All-Star game, where there was a lot of, kind of really casual pre-pandemic-like mingling among players, not all of them were vaccinated. And we have something better than serial testing and screening for symptoms, which is what we did before we had the vaccine. Now we have the vaccine. And so ensuring that we only relax behaviors when we have 100% vaccination rate, I think is the way to go with new Delta variant. Otherwise, things like this will happen. And of course, we're all worried about all the players that came back from the All-Star game and whether we're going to see more positive cases. But the bottom line, too, though, is that no one is gravely ill yet. And that is also a function of vaccination.
Yep, the vaccinations at work. Dr. Esther Choo, Oregon Health and Science University, Professor of Emergency Medicine. Thanks so much for being with us today.